Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, drugs which increase the intestinal motility are: intestinal motility is increased by neostigmine. Neostigmine is an acetylcholinesterase inhibitor which increases intestinal motility and which causes diarrhea. Whereas drugs which decrease the intestinal motility are as atropine decreases the intestinal motility and fentanyl decreases the intestinal motility. Because it is an opioid, it can also cause constipation. Atropine is a anticholinergic drug, so as a result it will decrease the intestinal motility and it can also cause constipation. Whereas glycopyrrolate is also an anticholinergic, it can also cause decrease the intestinal motility.
thank you and thank you for watching.